In this segment, we'll be looking at musculoskeletal anatomy and how our bones, our joints, and our muscles work together to create the various movement patterns we do in our group fitness setting. By the end of the segment, you'll be able to recognize landmark bones of the skeletal system, demonstrate movements that occur in all three planes, identify major muscle groups and joint actions they produce, explain the basic principles of human movement, and apply the anatomy knowledge into designing your class and your teaching cues. There are 208 bones in the human body, and luckily as a group fitness instructor, you do not need to know all of them. But it is important to know landmark bones and where they articulate or where they come together to make a joint. The first joint we'll look at is in the lower portion of the leg. Your ankle joint connects from your foot to the bones in your lower leg. Your tibia is the larger bone in your shin. The fibula is the smaller bone that runs on the lateral side. They attach into the ankle joint. They also attach into the knee joint. The knee joint then attaches to the femur, which is the longest and strongest bone in your body. The femur attaches up into the hip. And the hip attaches into what we call the pelvic girdle. The pelvic girdle has a couple areas that I'd like to look at on the screen. It's this larger semicircle bone that rounds at the top, called the ilium, and at the bottom, called the ischium. Notice that there is a bone fused in the center of the pelvis. That is the sacrum, sometimes called the keystone of the pelvis. The sacrum has 5 fused bones. The top one connects to the lumbar vertebra and starts the base of the spinal column. We have 3 different regions for the spine. The lumbar is your lowest. There are 5 lumbar vertebrae. On top of that is your thoracic spine. There are 12 thoracic vertebrae. And at the very top of the spine, your cervical spine, are 7 vertebrae. You'll see the thorax comprises of the sternum, this vertical bone in the middle of the torso, and the thorax also includes the 12 pairs of ribs. I like to look at the next region from the posterior side as well, the shoulder girdle. The shoulder girdle consists of your scapula, which you can see here on the posterior side, that triangular looking bone. In addition to the scapula, it articulates with the clavicle on the front side of the body. It articulates at the acromion process, that bony structure right at the top of your shoulder. The last region to look at is your upper extremity. We're looking at the humerus, the large bone in the arm from your shoulder down to your elbow joint. And then the bones at the bottom portion of the arm, your radius, which is the bone that aligns more towards your thumb, and your ulna, which aligns to the outside or the pinky finger. All movements happen in a plane of motion, sometimes in more than one plane of motion. In the sagittal plane, the body is divided into a right and a left half. I like to teach the sagittal plane by putting my right side of my body against an imaginary wall. Any movement pattern that I do where my body on the right side stays in contact with the wall is in the sagittal plane. So if I were to walk forward or walk backwards, I'm still in contact with that wall. So that is in the sagittal plane. I can move down and I can move up and still be in the sagittal plane. Joint actions that occur in the sagittal plane are flexion. If I were to do a bicep curl, my arm is in contact with the wall. If I were to do a tricep kickback, extension of my arm, I'm still in contact with the wall. We'll scan down and look at my ankle and talk about one other joint action that happens only at the ankle. Plantar flexion is when you point your foot down at the ankle joint, as if you're pushing onto a gas pedal. Dorsiflexion is when your toes come up. That movement, plantar flexion and dorsiflexion, happen in the sagittal plane because my foot would still be in contact with that wall. The frontal plane divides the body into a front and a back half. Take that imaginary wall and place it in front of me. Any movement that I do where I remain in contact with the wall is in the frontal plane. So I can move down and up, and I can move sideways, laterally. That's all in the frontal plane. Joint actions that occur in the frontal plane are abduction, when my arms at my shoulder joint or my legs at my hip joint go out. Abduction. Adduction is when the joint is moving towards the midline of the body. So this is abduction, this is adduction. That movement is still happening with my body in line with that plane of glass. Lateral raises occur in the frontal plane. Lateral lunges occur in the frontal plane. Shuffling occurs in the frontal plane. We'll have to scan down and look at my ankle one more time. In addition to plantar flexion and dorsiflexion, the ankle can inversion, with the inside of my foot coming up, eversion with the outside of my foot going out. More common is an inversion type of injury when we roll our ankle. That occurs in the frontal plane. In the transverse plane, the body is split into an upper and a lower half. So imagine that imaginary wall cutting through the midsection. I can rotate and twist in the transverse plane. Movement patterns or joint actions that occur in this plane not only are rotation, but this is sometimes called the horizontal plane. So if that imaginary wall jetted out to the horizon line, any movement that I made where my arms would stay in contact with that plane would be in the transverse plane. So horizontal adduction is in the transverse plane, and horizontal abduction is in the transverse plane. Movements like bicycle crunches or Russian twists are exercises that happen in the transverse. There are 3 types of muscle contractions. The first is the concentric phase. That is the shortening phase where motion is being created. In a bicep curl, it's the up phase of the curl. In a push-up, it's the pressing yourself away from the earth, creating movement. The opposite is the eccentric, the lengthening phase of the contraction. So lowering my arms during that bicep curl, or lowering myself down, slowing my body down towards the bottom phase of that push-up. The third phase is the isometric contraction. In an isometric contraction, we're looking to hold and stabilize a muscle. So that can be holding at the top of the push-up, holding at the bottom, or holding somewhere in the center. In a bicep curl, it would be holding my arms at 90 degrees, getting that isometric hold and preventing any type of movement. Now that we have an understanding of our bones and our joints, let's look at the muscles that are going to create the joint action. We'll begin at the lower portion of the body, again on the anterior side of the body at the lower portion. The tibialis anterior is the muscle that comes across that tibia, that large bone in our shin. The tibialis anterior works in dorsiflexing the ankle. If you can pan down and see my foot, when I lift it up, the tibialis anterior is shortening, concentrically shortening. That muscle is active in an indoor cycling class. If you were clipped into a bike pedal and you're making the completion of your pedal stroke, the back half of the stroke, Your foot is in dorsiflexion, and that muscle is active. The other two muscles of the lower leg are on the posterior side of the body, and that's the region that we call the calf. It's made up of two muscles, the gastrocnemius and the bigger muscle that sits underneath the gastrocnemius, the soleus. Those muscles work with your ankle in plantar flexion. So when the foot is coming down, so calf raises, jumping rope are working the gastrocnemius and the soleus. Panning up the leg, let's look at the muscles that act on the knee. The major muscle group is a set of 4 muscles called the quadricep. The muscles of the quadricep act when the knee is going into extension. If I pull my hip up and place my hand on top of my leg, when my knee extends, I can feel the quadricep muscles engage. The quadricep muscles include the rectus femoris, the vastus lateralis, intermedius, and medialis. Now, this is the first time we're seeing these types of words, so I'd like to take a moment to explain this. The vastus medialis, or any muscle that has medial, medialis, think about that being towards the midline of the body, or the middle. In this case, the intermedius is in the middle, and the lateralis is on the lateral, or the outside portion of the leg. That can help you remember that. So those are muscles that extend the knee. Your hip joint can do several actions. Your hip can flex, and it can extend. The tensor fasciae latae is a smaller muscle on the lateral portion of the hip, allowing your hip to flex. In addition, we have the sartorius, which is the longest muscle in the body, running medially, allowing your hip to flex. The rectus femoris, we just saw that as a quadricep muscle, but here is a time where we have one muscle that acts on 2 joints. So it acts on the knee, and it also acts on the hip. And finally, your psoas major, minor, and your iliacus. Together, these muscles are called your iliopsoas, and they also flex the hip. Exercises like high knees are going to work your hip flexors. Flipping over to the posterior side of the body, the opposing muscle from the quadricep is the hamstring. And the hamstring has 3 major muscles. The biceps femoris, not to be confused with the rectus femoris on the front side. The biceps femoris on the back side, the semitendinosus, and the semimembranosus. The hamstrings work to flex the knee. A common exercise in group fitness where we work on the hamstrings is to come into quadruped. It's often done with an ankle cuff around your ankles and flexing the knee, extending the knee. Flexing the knee, extending the knee for the back of the leg, the hamstrings. We just talked about hip flexion. Now let's talk about hip extension. You'll see that there are some similar muscles in this primary joint. The biceps femoris, the semitendinosus, and the semimembranosus, all parts of the hamstring, work in extending the hip, as well as the big muscle at the top, the gluteus maximus. When we are walking, running, we are moving into hip extension and firing those muscles. In addition to hip flexion and hip extension, your hip can abduct, abduct out to the side, or adduct in towards the midline of the body. The prime muscles that allow hip abduction are your gluteus maximus, gluteus minimus, and gluteus medius. Scan into your book or look on the screen and you'll see that the gluteus maximus is the largest muscle. The gluteus medius sits above that. The gluteus minimus is not shown in your book. It sits underneath the gluteus medius. The other muscle that allows your hip to abduct out to the side is the tensor fascia latae. This muscle sits at the upper portion of your lateral hip. And you'll see in your book there is an iliotibial band that runs down the lateral portion of your leg. It's a dense band of connective tissue that runs from your hip down into your knee, and its primary role is to stabilize the knee. This band of tissue can become very tight from our runners or for people that sit all day, so it's important to teach those members how to properly foam roll to work on that band of connective tissue. Exercises that would work hip abduction oftentimes occur in the group fitness setting on the ground. So I'll come down to the floor. From a side-lying position, taking my top leg and lifting it up towards the ceiling is hip abduction. Again, with ankle cuffs on our ankles, we can abduct the hip. In addition to hip abduction, we have hip adduction coming in towards the midline of the body. The pectineus, the adductor brevis, longus, and magnus, as well as the gracilis, which is running very medially into the body, all work on bringing the leg in towards the midline of the body. Again, from a side-lying position, I can demonstrate an exercise that works the adductors. Using my bottom leg and lifting my leg up towards the ceiling is working the adductors. You can also work the adductors by placing a ball in between your knees and squeezing the ball from neutral spine or from a bridge position. This is resisted hip adduction. Moving up to the muscles of the trunk. The rectus abdominis, sometimes known as the six-pack, is the band of tissue, muscle tissue, that sits on the front side of the body. The primary movement of the rectus abdominis is to bring the body into flexion. So think our crunches are getting that muscle to fire. We also have the internal and the external obliques that allow the torso to twist. Bicycle crunches, Russian twists are again movements that allow rotation to happen. In addition to rotation of the spine, we can laterally flex the spine. This sideways movement fires the quadratus lumborum, sometimes called the QL. An exercise I'll do on the floor to activate the QL is a side plank. Creating that little arch on my lower portion of my body, getting that lateral flexion on that side. In addition to flexion of the spine, we can extend the spine. There is a band of three muscles called the erector spinae that primarily serve in bringing the body into extension. I'll come down one more time to the floor to show you an exercise for the erector spinae. Supermans. Lifting the body into extension and slowly lowering back down. Lifting to extension and lowering right back down. As you can see in your book or on the screen, those muscles take up a large portion of the spinal column. We talked earlier about the scapula, the shoulder girdle. The muscles that act on the scapula are the trapezius. I want you to look at the screen for a moment here because the angle of the fibers really helps determine the movement of the scapula. The upper trapezius is going to pull the scapula up. We call that scapular elevation. The lower fibers are going to pull the scapula down. We call that scapular depression. The muscles in the middle trapezius and your rhomboid major and minor are running horizontally, and they can adduct the shoulder. Adduction, squeezing the shoulder blades together. It's the middle trapezius and your rhomboid major and minor. Exercises that fire the trapezius would be pull-ups. Exercises that activate the rhomboids would be a supported bent over row, kneeling on a step, pulling one arm up. There are three major muscles that move the shoulder. The first, the pectoralis major. This is the muscle commonly referred to as the chest muscle. The pectoralis major brings the shoulder into flexion. It brings the shoulder into adduction and horizontal adduction. So exercises like our push-ups and our bench press are going to activate the pectoralis major. The second muscle is the latissimus dorsi. This muscle group extends the shoulder. It adducts the shoulder, and it horizontally abducts the shoulder. Think about your pull-ups or your rowing exercises. That's going to engage the latissimus dorsi. And finally, we have the deltoid. The deltoid covers the shoulder. There are three parts of the deltoid: the anterior, the middle, and the posterior. The deltoid allows the arm to abduct to the side. We can also flex and extend the shoulder with the deltoid. So front raises and posterior raises. Looking at the upper extremity, the muscles that act on the elbow are your bicep brachii, allowing your elbow to flex, and your tricep brachii, allowing your elbow to extend. Bicep curls, tricep kickbacks are movements of the bicep and tricep. As a group fitness instructor, we're constantly monitoring our participants, and we're deciding whether they can progress an exercise or maybe they need to regress an exercise. There are a couple factors that will influence whether they can progress or they need to regress. The first being the lever length. The lever is your arm or your leg. The straighter the lever, the more challenging it's going to be to move or to engage that muscle, especially when weight is involved. If you have your participants in class doing a lateral raise and you see that a couple participants are starting to break form, encourage them to shorten their lever. This movement will be easier and their mechanics will be on point. The second is the center of gravity. Your center of gravity is where your mass is centered. As I'm standing here, my center of gravity is directly below me. But we're not static in group fitness classes. We're constantly moving, so our center of gravity is constantly changing. Be aware of any participant who is pregnant in your class. As they progress through their second and third trimester, their center of gravity will naturally tilt forward, obviously affecting their balance. So be aware of that and give them any props needed to make sure that they're safe. Your base of support is how many points of contact you have with the ground. Right now, I have 2 bases of support. And I'm standing with my feet underneath my hips and my shoulders, so I feel pretty stable. If I wanted to challenge my balance, I would minimize my base of support and bring my feet closer together. Or even more of a challenge, progressing into one stable base of support. Exercises that involve a small base of support or just one are obviously going to be more challenging. And finally, external factors. If you're teaching classes outside and it's a really windy day, your participants are going to be fighting against the environment, which would obviously increase the intensity of the movement. If you're used to having your participants run a certain route on flat ground, maybe challenging them and putting them on a large hill for the day would impact their ability to move. They might need to run at a slower pace to be able to make it up the top of the hill. When designing our fitness classes, we want to think about how the body moves as a whole unit. We don't want to train just muscles, but we want to train movement patterns. There are 5 basic movement patterns. The first is the bend and lift. Essentially, we teach a squat in class, which is a hinge at our hips and our knees, reaching to grab something off the ground and standing up. This is a squat, but when we're teaching our classes, we can translate into what this looks like in real life. So I might say, imagine picking something up off the ground and putting it on a top shelf. You're translating energy from your lower body through your torso and out of the upper extremity. That's a full body functional movement pattern. In addition, we have single leg movements, as if we're walking or lunging, stair climbing. These are all movement patterns where one leg moves in front of the other. Upper body pushing and pulling movements. When cueing a push-up, you can cue your participants to feel the muscles in the chest engage as if they were pushing a heavy door open. Or we're pulling with the muscles of our back, pulling something heavy towards us. And the last is rotational movement. Turning. If somebody calls your name and you're walking down the street, you rotate and turn back to look at them. So we're thinking about ways that we can cue what we're doing in our classes to daily movement patterns. You have a good understanding now of your human anatomy, how your joints move. Now what are you going to do with it? When you sit down to design your class, think about the exercises that you want to teach. Maybe it's a push-up. Make sure that we are balancing our body. We want symmetry, and we want to make sure that we're not overloading one side of the body. So if you're having your participants do a push-up, make sure you're incorporating the opposing muscle of the back to create a rowing pattern. You can also think about symmetry in your planes of motion. We don't want to always be moving in one plane of motion. It would be really boring to constantly be shuffling sideways in a dance class. We want to move forward, we want to move back, we want to change levels. Also, when you're teaching, your cues can really help every type of learner, the visual, the verbal, and the kinesthetic learner, to understand and educate themselves on their own human anatomy. If I were to take this band and have my participants do a letter T, holding the band out in front, the muscles that work with the scapula are our rhomboids. Your rhomboids are active when your scapula is pulling towards the midline of the body. Think about holding a pencil right between your shoulder blades. Pinch the pencil, hold it there, and slowly release. Cues like that will not only help educate the participants on their anatomy, but also sensations on how it should feel. We've all been in a group fitness setting where we're holding a squat position and we're starting to burn. Our quads, our hamstrings, our glutes are all very active. Make note of that. Get your students to reference where they're feeling it. Are your glutes burning? Are you squeezing your glutes? Can you squeeze your glutes as you stand up out of that squat? Talk about the exercise. Talk about the muscle group that is activated during the movement. And finally, I love to catch people doing something good. If you see Stacy in the front row and she's doing a perfect push-up, acknowledge it. It's going to make her feel good, number one, and it's going to help others. For example, Stacy is in a push-up position and her spine is in perfect alignment, including her cervical spine. So I say, great job, Stacy. Way to keep alignment of your cervical spine with the rest of your spinal column. That makes Stacy feel good, but it also cues participants that maybe were not in good alignment to hear that cue and pull their chin up, stacking their vertebra in proper alignment. I encourage you moving forward to think about the different types of fitness classes you want to teach and what exercises will be incorporated in those classes. Think about what we just covered here, how the joints move, what muscles are firing, and plan a workout that is balanced and safe. Thanks for watching.